Good day, ladies and gentlemen. Welcome to the patient engagement during the pandemic and beyond with your TELUS EMR. I would like to introduce Holly McCabe. Please go ahead.
Hi, everyone. Thank you for tuning in to this webinar on patient engagement during COVID-19 and beyond. My name is Holly McCabe, and I'm a Senior Marketing Communications Manager at TELUS Health. Presenting for us today is Darcy McHale, Director of Sales at Cliniconex, a TELUS Health partner. Darcy will be presenting on how Cliniconex can help your clinic adapt operations during COVID-19 and beyond. Thanks for joining us today, Darcy.
Thanks, Holly. Good afternoon, good morning, depending on where in the country you are. Thanks very much for the introductions. So yes, patient engagement during COVID-19 and beyond, effective communication from within your TELUS EMR is the basis of today's presentation. So what we want to do is overview what we mean by this, really kind of unpack the technology, give you a sense of how you can actually use it within your environment, and then engage in a conversation with Tracy Pugh of Credit Valley Surgical Center, so a peer of yours, talking about how she's experienced the Cliniconex's technology and how she's used it pre-COVID, what happened during the initial outbreak, and how it was, what the impact was, and then how she's been using it as a return to normalcy, if you will. So today's agenda will give you a sense of who Cliniconex is, what the service is all about. We'll speak specifically to a technology of ours, Waiting Room Concierge, which has a very good value proposition within COVID and how to manage patient flow. We'll speak to our core service offering, which of course is patient reminders and notifications. And then most meaningfully, probably for everyone on today's call, is a conversation with Tracy about her experience and some lessons learned, insights, tips and tricks, and so on. So just very quickly, of course, Cliniconex integrates with your TELUS EMR. So whether or not you're on Wolf or PS Suite or MedAccess, we're deeply integrated into thousands of TELUS customers. In fact, we help them deliver better patient engagement, increasing value through, reducing number of no-shows, increasing number of confirmations, and really using technology to automate what is typically done by way of manual burdensome process. So very quickly about Cliniconex. We've been in market for more than 10 years now in ambulatory. More recently, over the past couple of years, we've moved into senior care. In ambulatory, we serve 80 different subspecialties. And really, when you think about that, what we're trying to say there is when you think about a gastroenterologist or a cardiologist or an MRI clinic, the types of messaging and complexity of messaging required to set expectations, have people arrive on time, ready with their expectations aligned, is really quite varied. And as a result, the number of different features and functionalities, if this, then that, and all the different types of workflows we can manage is tremendous. And so the 80 different subspecialties is meant to sort of infer the fact that our workflow capabilities, and a workflow is really automating what you do today by way of manual process, to get those patients aligned with expectations and there on time is huge. We do this for north of 5,000 providers today across Canada. And on a regular basis, we're engaging with those patients on behalf of providers by way of telephone, email, and text message, north of 600,000 times a month. And that is making them aware of an event or something happening and asking for some type of outcome, an acknowledgement, a confirmation, a cancellation, whatever have you, and putting that back into the EMR so that you can, in fact, just use your calendar in the EMR to manage this as opposed to having some type of disparate environment. To date, in this calendar year, we've sent north of 500,000 engagements on behalf of these providers to their patients. So our portfolio of services really run the full spectrum of the patient journey, and by that I mean to say from before, dealing with waitlist management, sending out booking notifications, of course appointment reminders, communicating about COVID-19 screening, measures, and infection control, through to during, how to get patients greeted, how to get them inducted into the waiting room, how to move them through the queue, how to communicate wait times, and how to mitigate against, infection and exposure, all the way through to the continuum of communication after. Appointment recalls, of course, health campaigns and trajectories with respect to health campaign and communications, patient surveys, preventative care notifications, and infection control. So really, we look at our solution as a full turnkey that maps against the patient journey. So really what we're here to talk about today is adapting your clinic to COVID-19 and the new environment that you find yourselves in, and employing technology to help really communicate these new expectations and to help align patient expectations as to what you want as a provider, healthcare practitioner. So in looking at communicating through COVID-19, there's a couple of different use cases, and the first of which is really mitigating against having people in your wait room. If you have to have someone physically come in, you certainly don't want them passing through the threshold of your practice and waiting in a wait room with others. So how do you do that? Well, you can leverage our technology, whereas a patient can notify you that they've arrived, that they can stay in their vehicle. You can send them a message when it's time for them to come in, and they can be seen immediately. Therein mitigating against having too many people in the waiting room and really kind of keeping that flow in real time as you're prepared to see people. When you're talking about appointments over the telephone, really we can purpose our technology to set and align those expectations, letting them know that the physician will contact them at a certain time, that the physician may be calling from a blocked telephone number, that they should be prepared to answer that telephone number even though they don't recognize it. And that they should be ready 3 to 5 minutes in advance, and not leave it to sort of chance that they're ready. They should be sitting, waiting, and prepared for it. And of course, we're seeing a lot more virtual appointments, and so taking what would typically have traditionally been an appointment reminder for an on-site engagement and taking it to a video engagement with your provider and what you need to do. So when you need to join, how you need to join, some of the different things that you need to be able to join. And really sort of taking that expectation that once was the traditional face-to-face patient-provider experience and mapping it against either a telephone appointment, a virtual appointment, or if it still is face-to-face, really making it a much more efficient manner where everyone is protected against too much exposure to potential COVID. And then lastly, of course, that continuum of ongoing engagement, which is a post-visit survey, really looking at some type of timeline with respect to regular cadence to how was your visit, what do you need to know, is there things that we can follow up with you on, et cetera. So those are some just really short and simple use cases. In engaging with as many providers as we do across Canada, we really have the ability to kind of speak to the broad spectrum of the uniqueness that is you and accommodate some of the different things that you may be looking to do in changing the way you're engaging with your patients. So let's talk about our waiting room concierge service and what it's all about. And so we'll speak to the construct of it as is, and I'll frame it in today's use case, which is, of course, is COVID. So there's 3 components of waiting room concierge, the first of which is a wait time display, a means to communicate a wait time. So be it that you want to put this widget on your website so that people can see, oh, here's the wait time, this is the expectation I should have upon investigating going to see a provider, or upon it back, before COVID, going to actually go to a walk-in clinic. So that, of course, is great when things return to normalcy, but I don't think too many people are going to walk-in clinics. So let's talk about the 2 other elements, which I think are most relevant today, and that's patient queue display. And so when you're inducted into the calendar, and as a patient, as you're moving through the calendar to when it's your time to be seen, how do you manage that? Well, we have a wait time queue technology which can be displayed on your website and can be displayed in the clinic, but moreover can be a technology to let people know where they are in the queue and what the expected timeline for them to be seen is, and use that as a technology to action leave and return messaging. And so that can be messaging that, it's time to come to the clinic and remain in your vehicle, and 2 minutes before you're to be seen by the doctor, you'll receive a notification telling you it's time to come in. And that in fact, is the leave and return messaging. So as I said, wait time display for your clinic, being able to actually project that wait time without the need for people to come and ask and inquire, and to update that on a regular. A lot of times you have a wait time display, but it's best guess determination. Perhaps you've gotten busy and you haven't had a chance to update it. This is a technology that actually uses business intelligence to be able to project an accurate wait time and communicate that. Of course, it's customizable. You can employ your branding and put any messaging you want within it. And then, of course, the second piece and third piece is the patient queue. And really, that really prevents people from needlessly wanting to engage with the frontline team on, say, that person with the yellow shirt who arrived after me is being seen before me, and having to explain that, in fact, is someone who's being seen by another provider or whatever have you. Or if you're able to put this up on a website, it lets them know where they are in the queue and when the expectation to be seen next is. So how to best use a virtual waiting room. COVID-19 forced the rapid adoption of technology across the healthcare spectrum, and clinics really are looking for new ways to adapt to this, and virtual waiting room is a great way to do it. It's a way to provide a safe and secure and seamless transition of a hybrid model of remaining in your vehicle until it's time to be seen, or it's almost time to be seen by your provider for your video or telephone conference. Please ensure that you're ready or that you've logged onto the site, etc. And used in concert with patient engagement, it really creates that interaction again to communicate expectations, to align expectations so that the patient is ready for that interaction with expectations aligned as to how things are going to go and what it is they're going to achieve as a result of this healthcare engagement. So our core services, of course, are patient reminders and notifications. The basis of our value proposition, in fact, is to reduce no-shows, increase revenue through lessening the burden of your front-end staff, but also optimizing your calendar. And, nothing better than a customer testimonial about how we work very closely with our customers in the planning stages to understand their specific and unique requirements, the things that make them uniquely them in the way they engage with their patients, and support those in a few simple steps to be able to send effectively hundreds of appointment reminders all at once, saving hours which are repurposed for much more meaningful things in the practice. And so, the communication through COVID, you see patients wanting information and direction, probably arguably more so now than ever, and they want to feel confident that their healthcare professional is really going to meet all these expectations and take into consideration everything they need to make the best possible utilization of time and best possible outcome. Clinics, of course, must communicate this critical information, policies and procedures, expectations, appointment and operational changes, what's happened as an impact, and how things are going to be playing out in real time with this most recent engagement for that patient. And so really Cliniconex can help reduce this burden of communication and clearly set expectations through taking technology and really looking for efficiencies in the way that you're engaging with your patients and looking to improve outcome and messaging and increase your calendar. So if you look at our technology stack and you look at everything that we have that we bring to bear in the deep integration with the EMR and the way we're engaging with patients, we really do cover the full spectrum of before, during, and after through, again, our core services, which are booking notifications, appointment reminders, appointment recalls, health education, clinic cancellations. I mean, things change quickly, and being able to action that, not broad brush just for a day, but maybe for a period of time, a couple of hours or whatever have you, are all things that we do and we've been doing for many years, in fact, north of a decade. So I've talked a lot about bringing technology to bear, but let's not forget about the uniqueness of who you are as a provider and the way that you engage with your patients. And that really is one of the core value propositions of Cliniconex, is to be able to work with you and understand through effectively an interview what you do today, how do you do it, why do you do it, what is the construct of your messaging, and to be able to employ that through technology so that all those things that you feel make you uniquely you as a provider and that your patients come to expect of the way that they're communicated with is still delivered on just through the efficiencies of technology. And so be it through text messages or through email messaging, being able to employ, pointed messaging, to be able to ask for a call to action, a confirmation, and then to be able to follow it up with expectations of what's about to happen. Also being able to provide the functionality of, cancellations and notifications and request of a callback, et cetera. So, I've talked about text, I've talked about email, but still, hands down, the biggest way of communicating today is typically by way of telephone through automated messaging. And so we work with you. This is a sample of a script to really script what it is that you want and your messaging and how that messaging plays out. And so we'll work with you on an intro message, a main message, a user input message, a confirmed or a cancellation, and we'll really look to employ everything that you need through this script. And so multi-language, male, female, etc., gender messaging, it really is up to you as to how you want technology to be deployed and what the user experience might look like on the receiving end. One of the things that we don't speak about all that often, and in fact I thought would be a benefit for everyone on the call, is when you look at the construct of email or voice or text notification on an automation platform, and you look at all the different variables that go in to make up the construct of a message and all the different variations, it really nets out to be a tremendously huge number. In this case, in this analogy, north of 10,000. And really what you want is a technology that has the flexibility and business intelligence to be able to incorporate all those different things on the patient journey, if this, then that, if that, then this, and have them in a technology that has the ability to adapt and bring all those things to bear without having to have a whole portfolio and huge library of messaging which has to be updated on a regular basis. And so the messaging being, the message here being that the technology that we have allows you to employ all these different variables that arrive at the type of messaging you want without having the burden of a huge repository of different templates that you have to call on. And so really the analogy is here, 10,368 possible templates by way of voice versus one template with the business intelligence behind it to be able to deliver all those different variables. Which one seems like the most reasonable choice? We argue that choosing simple is of course, the best way to go. Let's talk about life cycle cost and the reference I made to a library of all these different templates. The ability to, create the content, control the messaging that achieve what you aim to do in the fewest templates is really about sending the right message to the right patient in the right moment and making that construct really meaningful to them and having the patient send back the right responses to the right staff member in the workflow and having this all mapped, having the knowledge of the way that you operate and not limiting you on the process and your ability to evolve and meet and grow as, your abilities or expectations or regulations change. We're not asking you to import or export files, and we're not asking your patients to log on to a portal elsewhere where they're asked to create new passwords and download an app or whatever have you. We're talking about the simplicity of really employing a technology that maps against you and sends through your integration with your EMR and your calendar to sending to a recipient that if they can receive a telephone call or a text message or an email, which of course they can today, then of course they can use the technology seamlessly and quite frankly, simply and beautifully to be able to achieve what it is you're trying to do today. So that's really the basis of what we do. And the way that it plays out is if you were to schedule an appointment in your EMR, Cliniconex would automatically send a notification to which the patient could confirm or cancel with their preferences. And in this case, let's say that they confirm. And what we do is we write back that result into the calendar. So in fact, that you can see at a glance in your EMR calendar, which appointments have been reminded on and what the status is, confirmed, canceled, whatever have you. So, again, another quick testimonial that the patient engagement solution has reduced the clinic's workload by 25%. Their previous system, they had to send notifications through a hodgepodge process that took about 5 minutes per patient, arguably maybe more efficient than making the phone call, but still a bit of a pain. So, it's a much cleaner and much simpler and much more efficient process using something deeply integrated into your EMR. One thing that we've seen a lot lately, especially with the return to practice, of course, there's always the mainstay new provider notification and notifying on that. Flu shot clinics, people are being a little bit more vigilant about getting the flu shots and sending out notifications. And then COVID-19 updates and changes. The ability to be able to bulk broadcast, send this, and have it done rather than having this continuum of losing time. It could be a couple hours, it could be half a day, or it could be an entire shift on this. Why not employ technology to make that happen? So I'm super excited, and I think that you should be as well, to hear from one of your peers Tracy Pugh is the office manager at Credit Valley Surgical Associates. A little bit about them and how they benefited. So first of all, they are a general surgery clinic located in Mississauga. There's 6 physicians. They're making use of TELUS PS Suite. They implemented Cliniconex in January 2020 to send appointment reminders and booking notifications via our integrated solution. So they're making use of email, text, and telephone technologies, and we've employed our technology to map against all those different modes of communication. And Tracy, if you don't mind, I'll just share a little bit about what our metrics tell us about you as an organization, and then we can kind of get into some questions that we have. So the technology was employed in January. Very quickly it was adopted to see 54% of those notifications sent out confirmed or at least opened and acknowledged, all the way through to seeing a steady increase into March, and then everything fell off the face of a cliff come April. And it would seem, as per your data, you guys returned to some form of normalcy, if you will, back in September, at which point, the number of confirmations continue to increase and rise. So it seems like users are really employing the technology to do the ever, so important confirmation of an appointment. So, Tracy, first and foremost, thank you very much for your time. Very much appreciated.
You're welcome.
Yeah. So why don't we kind of break it down like this? Why don't you tell us what your process was before you employed a technology, regardless of the fact it was Clinicnex, but what was it like before, you looked at technology to help you with this?
Sure. We were confirming our appointments via phone calls and sometimes mail, email, all very time-consuming and expensive. It took a long time. It took away from staff being able to do other things and generally created more work than not. Because, you're phoning people, they're phoning you back. It just is more phone calls and more unnecessary work.
And the telephone calls, I certainly understand that when you call someone and you call them about an event, especially something that had to do with surgery, there's likely way more questions other than just, thanks very much, what time, what day. There's arguably these engagements can probably be pretty lengthy at times. Yes.
As soon as they can engage you in person, that's the free-for-all to ask you every question that they have.
Right, yeah, for sure. So when you decided that you were going to look at technology as a way to address this concern, how did you land on Cliniconex, and ultimately, what was it about Cliniconex that made us the right choice for your organization?
Sure. We reached out to TELUS to find out what was out there on the market for appointment reminders. I was sent a few options by them, and we chose Cliniconex specifically because what you do suited our needs more than any other service, and certainly it's very cost effective, and it was very easy to set up, and your team has been great to work with.
That's awesome. So you said something interesting. You said what we do suited your needs more than any other. Can you just I want to just sort of pull on that one a little bit. What exactly do you mean by that?
I found that some of the ones that I looked into, you had to do more than just appointment reminders, like patients could online book their own appointments, that type of thing, which doesn't work in a specialist office. Your service offered us just what we wanted in appointment reminders and nothing else.
Okay, that's great. So you picked us up, you employed us as a technology, and really, was there an immediate benefit? Was it impactful immediately? Was it a bit of a slow burn? What was it like between January and April?
It was very helpful. We've had some staffing issues, and this certainly freed up time for the staff to work on other things and a lot less time wasted on. We basically used to take every Friday and spend that as a day phoning patients. So it immediately freed up staff for an entire day's worth of work to get other things done. And we definitely noticed an increase in patients attending their appointments and a decrease in no-shows.
Oh, okay. So, obviously losing an entire Friday is terrible. But to the fact, like, were you actively looking at, how are we doing with no-shows, or was it just notable, like, wow, we're having a lot less no-shows?
Because you get instant notification updating you on the status of all of the appointments, we were able to sort of scan through a few days ahead, look at things. If you see cancellations, you were able to fill them because we had more than enough time rather than somebody just no-showing. And it was just that we noticed that we had more time to fill appointments, and therefore more people were showing up. Because as hard as it is to believe, many people just blow off even specialist appointments like they mean nothing.
Yeah, no, I mean, it's pretty crazy. And I mean, a specialist, I can only imagine, number one, optimizing a schedule. You're a business, so that means net more revenue because you're making sure that the people are there and showing up. But on the opposite side of that, the associated cost of having someone not show up, I mean, those are resources that are lost and can't be repurposed because you simply can't schedule someone with immediacy, right? You need to give someone some more notice than just filling a vacant chair.
And especially because one of the things that Cliniconex confirms for us are our endoscopy appointments, which is a very valuable resource. And each surgeon only gets a certain amount of slots a week. And if they go to waste, that's a resource that can never be gotten back.
Okay. So we talked about like how the technology was, but I guess I probably should take a step back and talk about, you made the decision, you boldly went into something new, and I'm sure you were like, oh boy, what did I sign up for? How was the implementation process? Like, what was that like? Was it burdenous? I know that we get, we like to really understand the nuances about who you are, and we really like to understand the flow of, okay, what is that you're trying to achieve and how does this all come together? Like, what was that experience like for you? What type of commitment was it? Did you find it, were there lessons learned, tips and tricks that we shared with you? What was that like?
Well, for a dinosaur such as myself, it was
sure.
It was very easy. The team was great. They explained everything. They told us what you could do for us. The setup was extremely simple. It was done at a time when there was no implementation fee on your part, which was a savings to the clinic. And it was set up via a couple of phone calls and emails, and without a hitch, it was working for us.
Oh, that's awesome. It's not just you. I mean, I know your position in the organization, you have a lot on your shoulders, but you have teammates, and I'm sure it wasn't just you who was impacted in employing this technology. So what was it like for others? I mean, there's probably some that are close to what you're doing. There's probably others that just kind of had to be thrown into it. What was the general feedback across the team?
They were pretty happy to not have to sit all day and make phone calls.
Especially on a Friday,
yes.
like you said.
Yes.
That doesn't sound like a lot of fun.
Yeah, it was never a job that anybody volunteered to do.
Yeah, no kidding. So this is a pretty pointed question, but this is something that really people call us out on, and that's the way that our services work. And more specifically, I mean to say we're a transactional-based service offering, and so you pay for what you consume. You're not held to a monthly cost. And, there's two questions within. April through August, I can only assume you appreciated not having to pay for a technology. And then
yes, I mean, it was right, senseless for you to be on the hook and have to pay a monthly fee when we essentially shut you off for 4 months. Mm-hmm.
Which it's great that we're shut back on. I think everyone experienced some pain, but we're back on. Is there an upside to transactional costs for you? Do you see the benefit of paying for what you're consuming?
Absolutely. And correct me if I'm wrong, I believe you make 3 tries for each reminder.
Yeah, so we kind of call it like a cycle if you think about it. So we always think about like what it's like in the real world. Yeah, it's great to be a technology company, but it's only good if it really plays out like how you and I want it. And so we're not attempting 3 emails, nor are we attempting 3 text messages, because you can receive an email or a text and you can deal with them in, like I could be getting them right now in the middle of this WebEx and I'll deal with them later. But phone calls, which is, by the way, our biggest way of communicating right now, Who knows, in a couple of years it may shift. But if we don't get someone, we'll try again. And if we don't get them on the third time, we will leave a detailed message. And within your EMR, we will leave a status that tells, confirmed, canceled, or voicemail left. And so you'll know if someone's left a voicemail. And so, yeah, I mean, our technology does the best that we can do to get a hold of someone and to confirm, but we don't, I don't think anyone would appreciate 3 phone call attempts and then an email and then a text. That's just not the way people like to be communicated with. So, yeah, it's
Correct.
one cycle and you choose what you want. And, another piece is, of course, is you can choose a broad brush as
I was just going to say that your system allows us to ask our patients.
Right. So
if they
what did you
prefer an
choose?
email or, I'm sorry?
What did you guys chose voice, did you not, as a means for communication?
Most of ours are voice. We ask our patients for an email when they first register. We make them aware that we use this for our reminder system. A lot of patients are totally open to getting an email. And some people don't like a text. Some people like it, but you can't make everybody happy. We see that you do it different ways, and I can honestly tell you, since we started using it, I think I've only had one patient call to complain that they got a text.
Mm-hmm. But that's fantastic, and it's nice to be able to say, as an organization, definitively, this is what our messaging is going to be, and this is the gold standard of our message, and it's going to be predictably sent out every single time, because the way that I communicate versus the way you communicate is likely different. And it creates an opportunity for errors and omissions and inaccuracies, whereas something that's decided as a gold standard is always going to be a gold standard. So that's great. The second piece is the ability to say, like, okay, as an organization, we're going to employ a voice methodology to send these messages. But myself as a recipient, I can say, like, I'm on the phone all day. I don't want constant interruptions. Please send me a text message.
Right. And you do have the system to set up on the patient's chart, which we can tell you which one they would prefer.
Yeah, wonderful.
And, the monthly cost is nominal compared to what you're spending on staffing.
Mm-hmm. Yeah, no, for sure. I mean, employing technology, workflow automation is absolutely the way to go. I mean, be it Cliniconex or not Cliniconex, I mean, of course, I have a vested interest in everyone on the call today moving forward. But
of course,
if you're going to look at what you're doing, if you still have people picking up the telephone and still keystroking on every single appointment, please look at employing workflow automation technology. There's much more meaningful things you can be doing with your time. I really appreciate everything that you've spoken about today. I think it's super nice for people to hear it from someone like yourself. I think I'll leave one opportunity on your doorstep before we move on to sort of the next couple slides, is that do you have, like, lessons learned, tips and tricks? Do you have any insights? Do you have any sort of, like, I wish I knew then what I know now that you'd like to kind of leave with the audience?
I wish we'd set it up when we started our EMR.
So that wasn't rehearsed, everyone.
a long time ago.
Yeah.
We started with TELUS in 2011, and if I'd known then what I know now, you would have been doing this for us a long time ago.
Oh, wonderful. Okay, so I've got maybe 1 or 2 more slides, and then I'm optimistic that we have some questions. Tracy, I hope you are going to stick around with me and we can answer some questions together. I think it's nice to hear it from you. I'll back up the technology piece. Hiding in the background is Chris Sisto, my director of marketing, but moreover a product manager. So, look, you had made mention of the fact that when you employed this, you had the benefit of not having to pay the implementation fee. And as a thank you, we're extending the same offer for everyone on the call today and those listening to it recorded. If you raise your hand and place an order before December 31st, we'll waive that implementation fee. And it's not just an implementation fee because we can. There's actually business behind that. We have, Tracy spoke to it, we have subject matter experts who have been doing this for a decade or more, who walk you through the technology and ask you, interview style, what do you do, why do you do it, how do you do it, have you thought about doing it this way? If you could do it like that, would you? And then employ that as a technology solution offering. That's what the workflow implementation fee is, and we're going to make a concession through TELUS to simply waive that for you through to December 31st. Mike, I'm hoping that you can help facilitate some questions and answers for us.
Of course. So just to remind everyone to ask a question, please press 01. And we'll just give everyone a chance to queue up. Again, to ask a question, please press 01.
And Darcy, in the meantime, I have a few questions over the chat.
Oh, nice. Excellent.
Great. So our first question comes from Connie Lau. Connie's asked, can virtual waiting room queues be shown in patients' mobile phones?
Can virtual waiting room queues be shown in patients' mobile phones? Thank goodness Chris is here. Chris, do you have any insights on this one? This is a brand new one on me.
Yeah, absolutely. So what really waiting room concierge is a web application. So absolutely, it can be viewed on a mobile phone. Essentially, you would display that on your website, or we can create a URL for you. Essentially, the patients would be able to, on any sort of web-enabled device, they'll be able to see it for sure.
Thanks, Chris. Thanks, Connie. Great question.
Great. I have another on the chat while we give Mike a few more minutes to gather phone questions. This one comes from Cameron Berry, hoping to hear a little bit more about COVID screening calls.
Okay, I can cover that. Okay, Chris. Sure, Darcy, go ahead.
Yeah. No. So I think that's really the beauty about Cliniconex is that we can really customize all of our notifications to work any way you need them to. And so, if you think back to the appointment reminder that Darcy showed earlier where there's a button that says confirm or cancel your appointment, we've seen some customers customize that so that it says instead, like, have you seen any symptoms? If they hit confirm, it confirms their appointment. But if they say, yes, I've had symptoms, it automatically cancels their appointments and lets them know, hey, because you've had symptoms, we've had to cancel it for you. So it's kind of an example of how we could do pre-screening. But that's kind of the beauty is if you speak with our implementation specialist, the implementation team that Darcy referenced earlier, they can really customize that to work with however you might want to do that pre-screening or something of that effect. Darcy, anything to add to that? Or?
Yeah, I mean, again, I keep speaking to the implementation process, and it really is a fluid conversation, but interview style. And you may have an idea, a concept in mind. It's likely the person you'll be engaging with has had numerous conversations and likely has some insights for consideration. Of course, we're not going to steer you in any direction that you don't want to go, but we are effectively subject matter experts in this particular segment. And, we can help you refine the messaging to, number one, the most effective and direct way of communicating, but something that's more specifically targeted to your patients the way they're used to being engaged with as you as a provider. So, that's certainly something for consideration as well.
Great. Another question on the chat we have was from Karen Prasad asking about costs for appointment reminders, etc.
Right. So this product is actually resold by TELUS, and so while it has Clinicnex's sales information up, it's very likely you'll know who your TELUS either sales representative or customer success representative would be, and I encourage you to get a hold of them. Failing not knowing, there is the Cliniconex email address up on the screen, and we can help navigate that process for you. It is transactional. It's not subscription-based pricing.
I have quite a few more questions on the chat, but before we continue to dive in, Mike, do we have any over the phone?
Yes, we do have one question, but just to remind everyone, please queue up with 01 if you want to ask any questions over the phone. So the first one comes from Corina Franco. Please go ahead.
Hi there.
Hi, Corina. How are you?
I'm good, thank you. Actually, somebody just asked the same question before me. I know it's not a subscription-based software compatible, with the current EMR that I'm using, but is it per user, per doctor? Can you give a little bit more input?
Yeah, of course. So it's per reminder, and so a reminder, you could think of it as one email process, one text process, or a series of telephone calls to send a notification and in turn write back the confirmation. So that is effectively the price structure is it's on an appointment by appointment basis.
Okay.
So when you're sending a reminder about an appointment reminder or a booking notification or a clinic cancellation, you can think of each of those as an individual transaction unto themselves.
Okay. All right. I guess I can inquire more information through the sales department otherwise.
Sure. Wonderful.
Thank you.
You're welcome. Pleasure.
All right, and we don't have any other questions in the queue at this time, but again, to remind everyone, you can press 01 to get in the queue. Thank you.
Okay. Perhaps, Holly, you might have one or two more questions for us?
Absolutely. So this is from Beati Evans. The question is the service available in both French and English?
Yes.
That was easy.
Yes. Chris, do you want to expand on that? I always tend to understate.
Yeah. No, absolutely. French, English, and a multitude of other languages. I don't know the exact list off the top of my head, but I know that we've done things like Mandarin and others as well. Essentially, in the residence chart, you can specify what their language preference is. And for every type of message you have, you'd work with our team to craft it in whatever language you want. And essentially, based off the rules, it would say, oh, well, Darcy prefers to receive French messages by text, so he would receive a text message in French, whereas I might receive a voice call in English. So yes, we support a vast number of languages, most of which I wouldn't even understand.
And then about the attendant that we use, although it is an automated attendant, I've heard from colleagues, we have a couple different colleagues that speak different languages, that it's accent appropriate. That in fact, not only does it deliver French, but it delivers it in a French appropriate accent as opposed to me attempting to speak French.
Yeah, so I can confirm that. French is my mother tongue, and I was actually impressed by it.
Yeah.
It pronounced my stuff quite well, yeah.
But you weren't impressed by my French, I'm sure.
Not yours, no.
No. Okay.
Great. Another question from Gabby Wingerter. If a text message does not get successfully sent, does the office get a notification?
Right. So there is a status that you will be able to see in the AMR where you can tell whether or not a confirmation was acknowledged or whether you're still waiting for a confirmation. Chris, do you want to expand a little bit on some of those different features?
Absolutely. So in the EMR, it would actually show you sort of a code showing like CS confirmation sent. It won't be able to tell whether or not it was delivered, but that it was actually sent and it was an appropriate number. But what you also get is you get a daily report emailed to you showing all the communications that were sent out, on behalf of your clinic for you, as well as the result of those. So it will say, for example, confirmed or left voicemail, or it could say failed if there was a wrong number, for example, or if the email bounced or something like that.
Great. So we'll do one more question, Darcy, and this one comes from Susan Lynn. So for patient queue, is it based on appointment schedule or by check-in time?
Well, it's based on the EMR schedule, and so where they are in the schedule, the patient queue identifies where the patient, and doesn't, of course, display first and last name, everything. We can use some type of unique identifier on a patient-by-patient basis. But it's as they land within the scheduler, it triages and displays that way.
Great. And unless there are any questions on the line, Mike?
No questions in the queue at this time, but again, to ask a question on the phone, it's 01. Okay, we do have someone who just queued up. Give us a few moments to get their name. Thank you.
I have another question in the meantime from the chat. Another from Connie Lau asking how to make sure when calling is not picked up by our patient if there's a preventative care call, for example, your PAP is overdue.
I don't know that I follow the question. Chris, do you follow the question?
No, do you mind repeating that one, Holly? I kind of missed the end of it.
Absolutely. So the question is, Connie's wondering how to make sure when calling, if it's not picked up by the patient, if there is a preventative care call, for example, your PAP is overdue, what are the next steps?
Right. So, that's a very specific question. Essentially, you can create all sorts of rules depending on the EMR data. For example, like all patients that haven't visited given a set amount of time or so on and so forth. That exact scenario, I'm not exactly sure, but I mean, I'm almost positive that we'd be able to set a rule that says, like, if they don't answer by this amount of time, send a second reminder or something like that. And that's where our implementation specialists are the ones that would really know how to dig into that one. But we'd be happy to take that one offline with someone maybe more well-versed with those details than Darcy and I.
Yeah. Wonderful. So we are out of time. We'll take one last call from the queue. I think, Mike, you have that ready?
Yes, we do. So next question comes from Caitlin Hallett. Please go ahead.
Hi, everyone.
Hi, Caitlin.
A question. We have different types of appointments here. We have also a retail store in addition to a specialist clinic. We see patients for consultations and follow-ups. Are the confirmation, or for different types of appointments, are they customizable for like text messages? You know, you have to send in this questionnaire ahead of time. So just curious how you would differentiate between the appointments and apply those specific needs that we require for those individuals.
So I'll take a run at this, and Chris will usually round out my response. And so that's a big part of what the implementation process is understanding, look, some appointments are much more valuable or important, if you will, than others. And let's say, for instance, an appointment is so incredibly important that you want to remind, 2 months in advance, 2 weeks in advance, and 2 days in advance, then we can employ that just for that specific appointment type, where others may just be a quick reminder with a call to action. And moreover, some you may want to just send as informational messages without any requirement for a confirmation. You just might want to send some type of informational content. And so we can work with you dependent on the segmentation of your business, dependent on appointment type. We can work with you on, the cadence to which it's sent, how it's sent, and the construct of the messaging. And by that I mean to say not only what is being said, but if there are required elements like embedded, links or attachments that are required. So that's the big part about the customized workflow that we pride ourselves on, is the level of sophistication to be able to accommodate it, but the ability to be able to customize on appointment types and not hold you to just one standard. Chris, do you want to round that out? Is there anything that I left on the doorstep?
Yeah. No, I think that's well said. I mean, essentially based on the appointment type, the provider, or the location, you can kind of think of those as like different variables. We can say, like, here are the different messages that map to, if it's this provider and this location and this appointment type, send this message, but if it's this one, send that one, and same thing with all the call to action. So to answer your question, absolutely yes, and it's what we do best. Yeah.
Fantastic. Thank you so much.
Yeah, thanks for the question.
You're most welcome.
These live questions are fun. I like it.
They are. I really like them. I really like them too.
Do we have time for one more?
Absolutely.
Yeah, absolutely.
Okay. All right. So last question comes from Bhumi Yadav. Please go ahead.
Hi, everyone.
Hi, Bhumi.
Can you hear me?
Hi, Bhumi. Yeah.
Okay. So at our center, we are using PS Suite as the EMR. So I think this is compatible with our system, but we have 2 locations for 2 clinics. So I was thinking, if one of our clinic, in future decides to have Cliniconex, is it, are you able to implement it just for one clinic and not the other one?
Of course.
Yeah, absolutely. We can do it even for one provider if you want. If there's only 1 or 2 providers in a clinic, that's totally up to you. Absolutely.
Okay.
And we're definitely compatible with PS Suite. Yeah.
Okay.
Absolutely.
Thank you.
Thank you. So I'll take a first crack, and Chris, Tracy, to you first and foremost, thank you so very much for your time. Thank you very much for giving testimonial and for making yourself available and lending your insights to your peers on the call. Most appreciated.
You're very welcome.
Yeah. To my colleague Chris Sisto, thanks for stepping in and answering some of those questions. And to the team at TELUS, most gracious of you to have us as your guest on this webinar, and we really appreciate the opportunity. And to everyone on the line, Chris and I are eager to answer more questions, and we really hope to hear from you. And thank you so very much for your time.
Wonderful. Thank you again, everyone, for your time today. And, of course, thanks to Darcy for sharing this presentation on patient engagement during COVID-19 and beyond. Have a great day.